In our routine life, there are some common surgical conditions which we do come across. You know it well. Commonly seen are the hernias, appendix, then the concretions or stones, gallbladder stones, kidney stones, and piles, which is commonly known. So, one thing we must very cautiously think about these conditions, that many of these conditions are known for recurrence. That means once you do it, condition may recur, specifically the hernias. What are hernias? In simple to tell you, I will define that hernia is nothing but our body is made of so many compartments or chambers. When some content of some defined chamber enters in some other chamber, which is not defined for it, is called a herniation. Say for the intestines comes under your lower part or groin, leaving the abdomen content or the part of the abdomen cavity, it's called as inguinal hernia. When something your stomach is pulled up due to the chronic acidity of that is called as a hiatus hernia. When something in the upper mid of your abdomen, because of the dehiscence or weakness of that middle muscle, something comes out, that's epigastric hernia. Then, because of some previous surgery, cutting off some previous surgery, something bulges out, that is an incisional hernia. So, hernia is mostly known for the recurrences. So, as far as treatment of hernia is concerned, we must be very cautious. Okay, it is not that many times we blame doctors for recurrence, but it's not okay all the time. Because somewhere we are also responsible for the recurrences, some factors unknown to us. So we must give some cognizance to that, which I will be narrating here. Then you would see appendix. Actually, appendix, once it is removed, it cannot recur. But many a times that stalk or the stump appendicitis, a small part remaining behind after removing out the appendix. It can be stump appendicitis. Then for the gallbladder stones, in the gallbladder stones, we don't remove the stones only, but we remove the gallbladder. So after removing the gallbladder, it's okay that it will not again form the gallbladder, but if the tendency persists, so many times there are chances of having the hepatic stones, that stone formations occur in the liver, bile tree. Okay. In a kidney stone you don't remove the kidney, but the stones. But it is also again known for the recurrence, kidney stones, once you remove by any method. And nowadays, for a surgery, there are very excellent methods available, minimally invasive surgery. You don't have to cut wide upon. Okay. So even that, the kidney stones are known for recurrence. Then come for the piles. It's also very common ailment and known very well for the recurrence. What are the piles? Piles are just your pushed or pulled down your veins of your lower part of your gut. And there are various methods to deal with it. And also it's known for recurrences. So for all these commonly found surgical conditions, we say it very commonly found. But recurrences are very common and you are troubled a lot. So for that, it's not we should focus on the job of the doctor, but we must think of ourselves too, because this is a fact that for a surgery, at planned surgery is concerned, one factor is that it needs a pre-operative body building or health building, rather you say, and even the post-operative body building or health building, so as to suit the outcome of these surgical procedures, may it be open surgery, may it be minimally invasive surgery. Okay. And many a times when the surgical conditions are impending, that means they are just starting. So we can have even options of non-operative or conservative methods. Okay. If it is noticed at a very, very beginning stage, we can also opt for conservative methods. Even the appendix, if it is not a severe presentation or chronic, we can also manage it without the surgery, with a conservative method, what you say. And many times, it is an interval appendectomy when you remove at your own pace, if the infection is silenced. So this commonly look in surgical conditions. What I am saying this commonly because the occurrence is very high. And people are wondering here and there with the files of recurrences and everything. So it's what I want to say here that apart from doctors, there is your role also equally to be played in the case of surgical cases so that your outcome will be more soothing, your outcome will be more permanent. And for that, what's essential? You must know a basics of your health process. So whatever it may be, any sort of treatment, but as far as surgery is concerned, this is also very important thing that you must know your own health process because everything is something cause and effect. Whatever surgical conditions also, there is some cause. For example, hernia. The cause of hernia is a weakening. Weakening in that chamber, weakening in that particular foramen or something weighs out where some organ passes out to some other chamber. Say for example, esophagus descends down to that diaphragm into abdomen, from chest to abdomen. With a chronic acidity, that stomach is pulled up. And that is hiatus hernia. So hernia means weakness in your muscular or compartment structures that causing hernia. That weakness may be because of some previous scar. So definitely, unless and until the weakness persists, recurrence can be very common. So you have to be very cautious. Okay, because otherwise health is your own domain. It's okay, treatment is a part of a doctor. Doctors can make you disease free very well with their all armaments, knowledge, experience and their skill. Their job is to make you disease free only and that is their full stop. They can't carry you forward above that. Maximum stage you can carry is a disease free status. And if you want to travel ahead to the healthy status or universal health status, that's your own domain. That's your own baton you have to carry ahead. Okay? And for that you have to know some lacunas in us. There are some lacunas in us. Naturally, nothing is perfect in the universe. When something is given, something is taken out. So as we are gifted with such advanced intelligence and very nice body, there are some lacunas, universal lacunas also, which are hampering our universal health process and for which we are paying such a hefty price that instead of ever progressing medical science, we are seeing that we are very heavily suffering from the various diseases. Okay? So it's very high time to be alert. It's very high time to shift our paradigms towards the treatment of our own diseases. Medical fraternity, doctors, they are playing their role very nicely day and night. They are working for you. But it's a high time you must also be cognizant on your own role for your own health. Because health cannot be gifted, it cannot be donated, it cannot be transplanted, it cannot be injected. But that is only to be learned and earned self. Okay, that is to be realized and imbibed within us because health is a constant process. It's a flight. It's not a landed flight, but a flight in the air. And for that, you must be aware, you must be health literate and you must be health qualified. We are not health qualified since birth. What exactly the term, meaning of these terms, you will realize in other sections of this particular our initiative. But this is the thing. So while dealing with surgical diseases, may it be very common surgical diseases or very special, there remains equal role of yours in addition to doctors as far as smoothness or better outcome of your treatment is concerned.